The Latin American is a big region. We have 20 countries, and we only have bone marrow transplantation in 16 countries. We don't have hematopoietic stem cell transplantation in El Salvador, Guatemala, Nicaragua, and Honduras. And then CAR-T is, of course, is the most important discussion and question in our reality as a fantastic technology that could treat patients that do not respond or cannot do hematopoietic stem cell transplantation. But we have two very important points in this question. The first one is the access. Access not only to CAR-T, but the hematopoietic stem cell transplantation. Latin America have to discuss this before of everything. And now, in the second point, is to discuss which countries, which regions have to work on to reinforce the accessibility of CAR-T cell. Of course, in the middle and in low-income countries, we should have access to CAR-T, but we should have the logistic and the comprehensive of the situation. And to discuss this, we have only two initiatives in academic CAR-Ts in Latin America, in Brazil and São Paulo, of two groups from Butantan and the Universidade Federal Universidade Estadual de São Paulo, and the other group from Ribeirão Preto, and the other group is from Hospital Israelita Albert Einstein, and then we have in the northeast of Brazil, the Universidade Federal do Ceará. In this last initiative is based on a platform of Prodigy platform. And then it's a perspective of we can work with this platform. But it's very important to have initiatives of cooperation in the comprehensive access that the CAR-T from industry is probably the accessibility is not a good way for countries like Brazil or like another countries from Latin America, because the difficulties of access, the difficulties of to pay this for this treatment. And then we are going to discuss this in the session of Latin American bone marrow transplantation with my colleagues from Latin America, trying to find a way to improve this. Now we have an initiative with a group of Hospital Clínico de Barcelona, Dr. Álvaro Urbano Espizua and Dr. Manuel Juan, and that we are trying to work with some centers that have the capacity with good manufacturer practice and can work with this team of Barcelona that have experience with viral vector and try to expand this way in our region. We have, of course, we cannot lose our hope of that you are going to find a way to treat our patients with this very important kind of treatment now in these times.